Welcome to the Essence of Health Tea Time Podcast. I am your host, Dr. Shayla Toombs-Withers. As a double board-certified family and obesity medicine physician with over 12 years of experience in medicine, I teach motivated individuals how to achieve their desired quality of life while preventing and reversing chronic diseases. It's tea time. On today's episode, special guest Dr. Elizabeth Ssemanda is joining me to chat about our mental health. We'll be spilling the tea on how impactful our mental health is to our overall health and wellness, and Dr. Ssemanda will share some piping hot activating tea on how to handle holiday stress and panic attacks. So grab your favorite warm drink as we dive in. As a medical intuitive, healer, and life coach, Dr. Elizabeth Ssemanda is dedicated to helping others find peace in mind, body, and soul. With degrees from Brown University, Johns Hopkins Bloomberg School of Public Health, Warren Alpert Medical School at Brown University, and finally, psychiatry residency at the University of Michigan, Dr. Ssemanda seeks to pursue holistic treatment methods for people suffering from mental illnesses. As a board-certified psychiatrist, she specializes in helping healers heal, acknowledging that conventional treatments often ignore other aspects of the patient's wellness as if they only exist in 3 dimensions. Dr. Ssemanda created her practice called New You Psychiatry, where she offers holistic treatment options alongside psychiatric care within one location, and Soul in You, where she provides individual and group intuitive readings and healings. Continuing on her mission to change the conversation from coping with mental health issues to mental health wellness, she also hosts an empowering podcast called Stepping into Soul Power, which helps encourage listeners to understand their blocks, transform their relationships, and career and heal. So welcome to Essence of Health Tea Time, Dr. Ssemanda. Thanks for joining me.
Thank you. It's an honor to be on your show.
All right. With you being a psychiatrist, one of the common things I find is that a lot of people really don't know the difference between what a psychiatrist does and what a psychologist does, or a therapist. So can you just break that down for us?
Yes. So the big things are the difference in the degrees. So a psychiatrist is someone that has gone to medical school. And so they have that background, there is a medical school background. Like you went through surgery, you went through OB-GYN, you did all of it. You did
all the memories.
Yeah. You did it all. Whereas so that is what a psychiatrist that is. A psychiatrist can do therapy and can do medication management, but people can choose what they want. Once you get out, you can choose what you want. A lot of psychiatrists now focus primarily on medication management and less so on therapy. It's and that's unfortunate. It is unfortunate. So many of you, if you've been to a psychiatrist, a psychiatrist, a lot of times they're just focusing on meds, but they do have in residency, you do get trained how to do therapy. It is your choice whether you do therapy once you're done. So psychiatrists can do therapy and meds. Psychologist, right, focuses they didn't go to med school, but they did get a lot of extensive training in psychology. And so they do a lot of therapy. Many have PhDs. So that's and they can also do really in-depth neurocognition examinations. And many times you'll see a psychiatrist may refer someone to a psychologist because they know that that person is really going to be strong when it comes to therapy, as well as a super thorough psychological exam. A therapist is someone who they're proficient in therapy. There's so many different levels of therapy. They're like licensed, they're like LPCs or marriage and family therapists. Like there's, a lot of therapists have master's degrees. So all three can do therapy. They can do therapy. Whether someone's good at therapy or not varies. And in fact, what you need to do when you go see somebody is like listen to your gut. If you feel like you go somewhere, it doesn't matter what kind of degree they have, and you feel like you're not being heard, it's time to go.
Oh, yeah. I'm so glad you said that because, me being a family physician, I've had a lot of patients tell me, even just mentioning therapy to them, sometimes they are concerned. They've had negative experiences with some therapists. And I always, have that same discussion too. Like, it's not a one size fit all, as we know. And you really do kind of have to shop around sometimes to find somebody who really gets you and your concerns and who you really mesh well with. So that's a very good point, for you to note that, it's not all equal, and for people to find somebody really for themselves and their needs. And I also find too, in the therapy world, that they have different, almost like subspecialties, if you will. Yeah, which is, and I don't know if that's kind of a newer thing that's come about. You may know better than I do, but it just seems like I've seen more and more where some will subspecialize in maybe just postpartum depression, and some will just, marriage and family, and some just with, developmental issues.
Yeah, there are so many different types of therapy. Like we say therapy, and that's also why I could understand why someone specializes in a particular type. Because, there's cognitive behavioral therapy, dialectical behavioral therapy, psychodynamic therapy, motivational interviewing, interpersonal therapy. I mean, I could list the therapies for days. And also, like, that's what, that's the tricky thing when you're looking for a particular therapist, is like, you need to make sure that they're proficient in what they're gonna know what they're talking about in the type of therapy that you're looking for. Like, if you are looking to, there's some people, you want to go to therapy and you want to vent. Great, more power to you. Great. But there are other people, they want to go to therapy and they want to learn skills. And there are only certain type of therapy, like you need to know the type, because some therapies are not about learning skills. And so, like, just like you vet, or at least I would hope, if you have a lawyer, you vet your lawyer, or you vet your plumber.
Yeah. Even your dog groomer. I mean, we vet most things.
Yeah. Oh, you vet your babysitter. The same thing. You gotta vet your therapist, vet your psychiatrist, vet your psychologist.
Yeah. And so with that same breath, then, when should a person seek out a therapist versus a psychiatrist?
So I think I'm a big believer in, like, first, like, even before you decide to seek help, go, like, ask yourself, what do I want? What am I looking for? Listen to your heart, see what you want, right? And if you're looking for, if you're not necessarily interested in meds, then I think it's safe to go the therapy route, or at least start off with a therapy route. It's definitely cheaper. Like it's cheaper to see a therapist than a psychiatrist. And kind of like what I said, like, I do therapy, but that I'm rare in the breed of psychiatrists right now. Like most psychiatrists.
I agree. Yeah. You may be one of the few, Dr. Ssemanda, that I actually know in psychiatry who does also do the therapy side.
Yeah.
If you're frustrated with your weight, taking more medications than you'd like to, have been told that you are at risk for the development of a chronic preventable disease, or just are not feeling in the best of health, then I'm talking to you. Why? Because you're tired of fat dieting, you know it's time for a change, and you want a sustainable plan to improve your health. If you have found yourself at this place in life, well, I have developed a program that's just for you. It's called The Essence of Health, and it's your prescription for transformation. My goal with this program is to give you the tools needed to create sustainable lifestyle changes within a group coaching setting, along with one-to-one individualized coaching to give you a personalized path to health that's just for you. The benefits are priceless, so join today. Head on over to eohcoaching.com to learn more. The essence of health is in you.
Yeah, so I think if you're not interested in meds, like start off with therapy. If like, and then the other thing I would say is your functioning, right? Like how are you, if you aren't getting out of bed at all, and it's things are super, super severe, like you haven't left your house in 6 months, and I've had those people, like you may, that's, those people may want to like seek a psychiatrist.
Yeah.
The other thing too, is if you have a lot of like, there's some reasons why you would see a psychiatrist, and if you have a lot of complicated medical stuff going on, then I would say, yeah, it's okay to even start with a psychiatrist, because a lot of times medical things can look psychiatric. Like there's this interesting complex relationship that I mean, we're super complicated. And some medications can make, you get your cortisone shot, you might be sky high and manic. So
Yeah.
so some people like if you have a lot of medical stuff going on, and a therapist is not gonna understand, like they don't have the medical background.
Right.
So yeah, then you'd also want to see a psychiatrist first.
Yeah, for sure. That's a great point too. I can, just even think back to residency working in the hospital. And you're right. Sometimes people will get admitted for some psychiatric problem when it turns out it was really more of a medical issue that looked like a psychiatric issue, and it definitely was not. So yeah, and it is important for that healthcare person, that doctor, to know the difference. And so yeah, that does. That's a great point. So with that in mind, how does mental health, would you say, play a part in our overall health and wellness?
So I'm a big believer in, we're all, at least in the way that I look at life, is that we're all connected. And mental health, like it really affects your quality of life. And if your mental health is poor, it's hard to enjoy like all the beautiful things that this world has to offer. And so it is part of health. It is, it is part of wellness. Like our mind, like we think. We are powerful, beautiful human beings, and your capacity to think, your emotional state, like it influences everything, and it colors things too. If you're depressed, then you could be a millionaire, you could have all the support in the world, but still really not be living a fulfilling life. And so it's super important to tend to your emotional, your mental, your spiritual well-being.
That's so true. Yeah, we see that almost every day amongst, in the media, with a lot of our celebrities even. And, you see these people on television and you would feel like they would have the best lives, but, they struggle with mental health issues and some with substance abuse issues. And, it's right. Like you said, it plays a huge part even in your overall health and wellness. And so, yeah, that makes a lot of sense. One of the things that I present to clients and patients from the physical aspect of health is mind-body balance, and the thought that if our mindset is not right, then even the other parts of the other components of our health and making health change, and with our nutrition and with exercising, all of those things can be in place. But if your mindset is still not right, you're still not going to gain a whole lot from those other components. So it really is a huge part to that.
Absolutely.
Yeah.
Absolutely.
Thank you for listening to part 1 of the special interview with Dr. Elizabeth Ssemanda. Stay tuned next week to hear part 2 of this special episode, where you learn more about your mental health and ways to improve it. Take care. Join me on Sunday, November 20th, 2022 in Knoxville, Tennessee at the Scruffy City Vegan Fest, where I will be discussing the topic of food addiction. There will be an amazing lineup of speakers, and I'm sure some delightful plant-based food to enjoy. Hope to see you there. Thank you for joining me today on the Essence of Health Tea Time podcast. Click the subscribe button on your favorite podcast platform so that you never miss a moment of the Essence of Health Tea Time podcast. Check out the show notes to obtain your free tips for healthy living guide to get you started on your health and wellness path. Follow me on social media at Essence of Health Wellness Clinic on Facebook, Instagram, and YouTube, and at dr.tw@EOHWC on TikTok. Interested in becoming a member of the Essence of Health coaching program? Well, head on over to www.eohcoaching.com. The essence of health is in you.